Hey, well, thank you. Thank you, Emily. And I'm just so thankful to Dr. Morris for his presentation and that validating presentation that we are on the right track in Kentucky, but there is still opportunity for so much more to do. And I really thank him for reminding us that we need to establish nicotine-free policies and tobacco treatment services as essential components of offering whole health services, especially with the focus of recovery in these populations. And the best way I can think of following such a wonderful presentation and the excellent networking time we had when we broke up into breakout rooms and the discussions is to place the spotlight on each of you who work in our Kentucky communities, serving those who are living with mental and behavioral health challenges. So I just wanted to say a big thank you for all the work that each one of you is doing in this area. And, Confucius once said that the man who moves a mountain begins by carrying away small stones. Now, those small stones may feel like mountains sometimes. And this is why we celebrate each stone, each challenge that stands in the way of improved patient outcomes in recovery. One of the most impactful ways to support recovery is providing and engaging in tobacco treatment support. That's why today we would love to present two inaugural Behavioral Health Tobacco Treatment Awards. So you submitted the nominations, then the nominees were reviewed by an external blind review committee to determine today's award winners. Hey. Feel there should be drum rolls. Well, the first award is the Behavioral Health Wellness Tobacco Treatment Integration Award. And this award honors an organization that has demonstrated continued access or continued success in the tobacco treatment field. And it's made significant contributions in addressing tobacco-related disparities for those living with mental and behavioral health challenges. The person who nominated today's winner had this to say about the organization. The organization demonstrated continued success in tobacco treatment field and has made significant contributions in addressing tobacco-related disparities for those living with mental or behavioral health challenges. They assisted with the local tobacco policy and use assessment survey design and implementation, seeking to understand tobacco use policies and treatment across all local community behavioral health facilities. This organization had trained tobacco treatment specialists who actively worked on tobacco dependence treatment for individuals living with mental and behavioral health challenges. And this organization expressed that it was a priority that they would have tobacco treatment specialists at their agency. They collaborated with a no-cost nicotine replacement therapy program, which is being implemented on site in their pharmacy. And this organization is currently a smoke-free or tobacco-free organization and has signage posted to inform clients, staff, and visitors. They're in the process of reviewing their existing tobacco policies to make sure that it's up to date and comprehensive. This organization is a great example of a behavioral health center making significant contributions in addressing tobacco-related disparities for those living with mental and behavioral health challenges. Now, so much more was said about this organization and the impact that they've made in tobacco treatment services for their patients and within their organization and in their community. So the inaugural BHWell Tobacco Treatment Integration Award goes to North Key Community Care. And I would like to welcome representatives from North Key to accept this award. So please unmute yourself and introduce yourself and share some thoughts if you're here.
I'm here, and I really appreciate this. My name is Christy McGovern, and for the past 2.5 years, I've been the project director for the CCBHC expansion grant that North Key has had, through which really focusing on tobacco treatment has been and screening and treatment has been a priority for us. And so through that, just have met with Dr. Okoli and Heather and Emily and others for at least, I would say at least about a year and a half. And I really appreciate just all the resources and the knowledge that you've passed on to us, because this was important for us to begin, again, focusing and implementing this. And so like you've really, through the TA sessions and meeting to plan like the quit and win contest and other things and like trainings that you've offered, it's really helped us. And as we've been moving forward with our initiatives and everything. So yeah, I just it's an honor, and I really appreciate you recognizing us and some of the steps that we've been taking. So and also I want to say that the tobacco treatment specialist program that you've offered, like that has that's enabled us to have several staff trained, and that's been very helpful as we've kind of worked through the things that we needed to do over the past couple of years. So, and there's more growth, of course, that we'll be doing, but thank you so much.
Thank you, Christy. We really treasure the work that you're doing with North Key and for your community and your patients. And it's been such a wonderful partnership that we've had over the last about a year and a half now. So congratulations to North Key. And since this is a virtual event, your award will be in the mail. Okay. Now, the next award is the BH Well Behavioral Health Tobacco Treatment Specialist Trailblazer Award. This award will be presented to a tobacco treatment specialist who is a champion for tobacco treatment prioritization within their organization and who's making significant contributions in treating tobacco dependence for those living with mental and behavioral health challenges. The person who nominated today's winner had this to say about the behavioral health tobacco treatment specialist. When this person began working in the organization, the need for helping others quit tobacco was obvious, as a majority of the patients enrolled in this program continued to use tobacco. This person voluntarily enrolled in the TTS program to become a tobacco treatment specialist so they could help motivate these individuals in their quitting journey. Since that time, this person's role has evolved into a full-time position as a tobacco treatment specialist, where they daily counsel individuals working toward their desired goal of stopping tobacco use. Patients who strive to quit nicotine use always mention that the tobacco treatment counseling piece helped them to be successful. Since this group, the organization of this individual has implemented a tobacco treatment service referral system for adults, they're now working towards a referral system for youth as part of the collaborative. Because this individual is an early adopter of the tobacco treatment specialist program, other nurses have joined the effort and change in taking place throughout their catchment area. It takes intelligent, dedicated, and caring professionals like this person to inspire change in the lives of those who desperately desire to have better health. Well, what an amazing journey with significant impact. So without further ado, the inaugural BH Well Behavioral Health Tobacco Treatment Trailblazer Award goes to Holly Lodson from Owensboro Health. Holly, if you're here, we'd love to say hi, and if you have a few thoughts, please unmute yourself. Well, Holly, you are muted. There you go. Okay, you're unmuted, but we can't hear you. But Holly, congratulations. We're so proud of you and your achievement, especially in completing the tobacco treatment specialist program, but also what you're doing and all the lives that you're impacting. And again, as it's a virtual event, this year award will also be sent to you in the mail. Okay, well, thank you. And just some closing thoughts to share. We'd first like to thank the Kentucky Department for Public Health Tobacco Prevention and Cessation Program, who provided the support for today. And I'd like to thank the entire BHWell team. I'd like to spotlight Emily Koyagi for her tireless behind-the-scenes effort to make today such a success. Thank you for coordinating the workshop, as well as all the other members of the BHWell team. And just want to thank you all once again for coming, for being part of what we're trying to achieve in Kentucky, to move the needle and, like Gary said, move the arc a bit more towards enhancing tobacco treatment and tobacco program policies within mental and behavioral health services. So thank you so much for attending, and I hope you have a great rest of the day.